do a little intro on my Instagram lives as to how I kind of came across you. And from what I can remember, we both commented on an Adam Meakin's post. I'm pretty sure it was about accessing vaccines at the GP. And I must have commented something about like what it's like in Australia. And then I saw you commented on my thing, something or the other way around. And then I went on your you were in Brisbane and did powerlifting. And your coach, actually, I've just coincidentally followed her for years and always thought she was kind of impressive woman.
Yes.
Oh, okay, cool. Like there's another person in my city to follow. And obviously came to learn a bit about your history, and you've obviously gone down the sort of niche of exercise in cancer recovery, which, as I just said, I know nothing about really. And we've had lots of good little chats in the messages about the pitfalls of physio as a profession and how it failed, I guess, and it's failed to sort of enter that exercise space. But we're both quite passionate about making sure physios continue to be one of the prime sort of professionals working in exercise and rehab. So you come at this from some personal experience. So could you give a bit of background about like what brought you to this point as a physio, and I guess a bit of your personal experience as a cancer survivor as well?
Oh, okay. So I started out, I've been a physio for 27 years, and my first, I know I'm old. So my first 10 years was private practice, sports, occupational health. But it was, you know, the 90s and early 2000s, and it wasn't a very fulfilling, with, you know, clearly with all the new evidence we've got, we know that what we were doing wasn't very effective. So then I moved to where there was strong evidence. So a lot of chronic disease management. I worked in pulmonary rehab for many years, inpatient cancer care, inpatient rehab, palliative care for a long time. I loved that. And then about 4 years ago, I started working at the most amazing place. It's in Toowong. It's an over 50s clinic. We have exercise physiologists, physio, audiology, dietetics, etc. Clinical education, so a lot of students. But the facility is amazing. We're over 2 floors. We've got 9 clinic rooms. We've got 2 gyms and a separate exercise space. So, it's a great place to work. So cancer exercise is not my specialty at work. I'm general Jerry, but I love cancer exercise. Osteoporosis and pulmonary rehab are probably my 3 loves. And the 3 of them all are super crucial in cancer care. Yeah. Because we've got bone density issues and then a lot of, cardiopulmonary compromise. So all those years and years and years of working with breathless patients, I applied to myself when I was breathless during treatment. So that's my day job. Yeah. And then I've partnered up with Cancer Nutrition HQ, so Dr. Crystal Zuniga, who's an oncologist from Austin, Texas, running group health coaching for cancer survivors. So it's still in its early phases. We've done our first program and tested, and now we're just updating it.
Oh, okay. That's amazing. I didn't realise that you were partnered with someone in America. Can I just ask?
I know, it's wild.
This is a question without knowing a little bit. This is just for my interest. So at your job, as a physio in that space, and there's obviously exercise physiologists as well, in that sort of environment, what's the difference there?
We've got a lot of areas where we do overlap.
Yeah.
So there are areas where it's either the ex-phys or the physio doing the work. So like in the cardiac and the pulmonary rehab classes, it's, either or.
Yeah.
And, healthy aging classes. We do have a musculoskeletal service. So we do have a musculoskeletal specialist physio.
Oh, yeah.
But in terms of student education, my student is classified as community.
Okay.
Whereas the specialist musculoskeletal, her students are classified as a must placement. So there is a lot of overlap in that area, and there are areas that used to just that used to be physio, so like pulmonary rehab. But I think we've dropped the ball a bit with our exercise science, and exercise physiology has taken over.
Yes.
But there's no reason. Look, my youngest son is first year physio, and it is a completely different experience to my first few weeks of physio.
Okay.
And there is a lot more focus on exercise science. I'm really happy. You know Steve Collins?
Yes, of course I.
Yeah. Well, he'll be teaching my son next year.
God, that's...
So a lot more emphasis. Yeah. And physio students are taught exercise science, and when my students come, I go through your basic exercise. They do tutorials, and we get them to practice. Exercise science, and how to do a 1RM prediction, and really trying to nail that down. And then all the cueing, external and internal, cueing, getting them to be decent at cueing their exercise.
Yeah.
But if you don't have a good understanding of exercise science, you cannot be an evidence-based clinician, because you need to know, like, for example, we're an over 50s clinic. New guidelines came out last year, really exciting, more aggressive than anything before. And they're now saying resistance training at 70 to 80% of 1RM.
Yeah.
And if you don't know what that means, you can't dose your exercise properly. It's also talking about HIIT training, power training, impact loading. If you don't understand exercise science, you can't dose properly. So I think the training at universities is improving,
okay.
But for physios like myself that had none of that training and wasted years of undergraduate training doing rubbish like electrotherapy and posture assessments, I've had to work really hard to, and I've been to loads and loads of courses.
Yeah.
So if you don't understand exercise science, go upskill.
Yeah.
Yeah.
Funny, isn't it? Because I feel like in my undergrad, didn't learn that much about exercise prescription, either one subject on it, like what thing. Like obviously every body part subject had exercises for that body part, so it's probably a thing. But like 5RM, percentage of 1RM, like all that stuff I learned I actually did like PT courses when I was in Kuwait. And then working with personal trainers in a gym in Kuwait, like that filled that side of my knowledge, which I'm so grateful for. But something it did not fill in the gaps is working in particular populations. So in cancer, sort of, I guess people who are having cancer treatment, so say someone who is having chemo or radiation therapy, what's the deal with exercise at that stage? Like, could you give me a bit of information about that?
Okay. Strong evidence that exercise, the evidence is really strong. So there's really strong evidence that exercise helps alleviate the symptoms. So the primary symptoms of, fatigue, pain. Everyone thinks about people vomiting in a bucket during chemo, but it's fatigue that's awful.
Okay.
So there's a lot of research around that. There's a lot of research showing the lower your muscle mass, the more toxicity you have, and you're less likely to be able to complete treatment. They might have to adjust your dose because of the toxicity. There's evidence, I've only seen it in animal studies, but my oncologist said to me, you have to exercise so that more chemo gets into the tumours.
Okay.
So that's been proven in animal studies, but not in human. But since 2016, this is what my oncologist told me at our very first meeting. She said, if you were in Western Australia, you would be going straight from chemo and radiation to the gym for supervised exercise, supervised by exercise physiologists. Yeah, they share a waiting room.
Okay.
It's the same waiting area. So I guess the key message is exercise is cancer medicine.
Yep.
So we've got So there's also emerging evidence that it may help further suppress tumour growth. So it's been, So I watched the documentary just before I started chemo, and I just had this strong visual all the time. And they showed these mice that were, with different cancers, and one set of mice could exercise as much as they wanted to, and the other mice didn't exercise. And then, this is sounding really gross, but it kept me exercising. But then But then they, dissected them, and the exercising mice, their tumours were at least 60% smaller.
Oh.
So that visual of that picture, yeah. So it's gone on to, in a lab setting when people do high-intensity exercise. So in Brisbane, Dr. James Devon, his group did this. It's been replicated by Rob Newton in Western Australia with prostate cancer survivors. You do high-intensity training, they extract your blood and then extract a serum, put it on cancer cells, in a dish, in a lab setting, and it suppresses tumour growth. So I'm not advocating, it's not a cure for cancer, but it's it's looking like it could. In terms of clinical, the only research I'm aware of is in esophageal patients that got done this year. It wasn't randomised,
okay.
But they did split them up into one group did supervised exercise and the other group just standard care. And the group that had supervised exercise had less, their tumours shrunk more.
Okay, so
the potential implications are massive, and like as a cancer patient, you're not going to sit back and go, oh, we've got to wait another 20 years for it to be proven definitively that it might further suppress tumour. You're like, I've got cancer now, man. I've got to exercise now. So we've got the strong evidence for the side effect reduction and being able to get through treatment, and then this new evidence saying it gets more of the medicine into your tumour and it further suppresses tumour growth.
So what?
And not only that, in survivorship.
Yeah.
In survivorship.
Yeah.
Again, there are some randomised control trials happening now, but in epidemiological studies, when they look at cancer survivors, the more you exercise, and if you're exercising at more vigorous intensity exercise, you're less likely to have cancer recurrence. Or if you have cancer, you're less likely to have a progression of your cancer. So, again, it's only observational. But if you've got cancer now or you finish your cancer treatment, you're not going to sit back and wait years for it to be definitively proved. But I know that there are studies in prostate cancer happening worldwide, colorectal, probably breast, I'm not sure. So all I know is if I were the patient, I would want to be randomised into the supervised exercise group.
I guess that's a challenge, because it's like if it's likely that it's so helpful to do a study with people with cancer in it and tell them not to exercise so that it could be a control, it's really unethical, isn't it? Like you can't actually, especially for something so risk like exercise, it's like telling people not to do it might actually make their cancer worse. I almost feel like you couldn't get ethics approval for that.
Yeah. They're not told what to. They're just given a book. So the difference is, I know for the prostate cancer, I listened to Newton. The difference is the exercising group has supervised exercise twice a week, and the control group is just given usual care, and they're given a booklet telling them,
Okay.
I think that's the only way you can get around the ethics. I think, the booklet tells them what exercise they should be doing, or the recommended exercise guidelines.
And so is it just is it just the same recommendation of exercise as it is for people without cancer?
So the Australian and American guidelines are pretty much identical. They recommend as soon as you're diagnosed, you work up to and then maintain 150 to 300 minutes per week of moderate aerobic intensity exercise, or the 75 minutes of vigorous per week, and 2 to 3 resistance training sessions per week. And they're pretty, it's 60 to 80% of 1RM. So it's a decent, a decent intensity of resistance training. It's not like back when I went to uni, you'd all sit around with little, half-kilo weights sitting. Everything was sitting. So, so that's the guidelines. And the sad thing is only 8% of cancer survivors meet those guidelines. Oh, can I just say that cancer survivor, the definition of that is the minute you're diagnosed to the day you draw your last breath, you're classified as a survivor. Some people don't like the word, but as a medical word, that's what a cancer survivor means. It just, it means that you've had cancer.
What?
So only 8% are meeting the guidelines. And in terms of oncologists recommending it. It was so hard to do. I'll just say that exercising during chemo and radiation is so hard because you feel so tired. Like fatigue is the primary symptom reported in the literature. And it's really, really hard to overcome that fatigue. You've also got bucket loads of systematic inflammation from all the treatments. So you've got lots of joint pain. So you wake up in the morning and you feel like, 120 years old.
Oh, my God.
So but I had my oncologist and all the nurses all saying exercise, exercise, exercise. But if you look to the literature, I had a look, it's less than half of oncologists promote exercise to their patients.
Right.
But then you deep dive further, only 20% of oncologists actually exercise themselves.
Yeah.
So I think that could be part of the problem.
Yeah.
But I think I was just really lucky to have such a great oncologist and such a great powerlifting coach who, I could tell that she'd been, doing lots of reading and research because she started throwing lingo in when we were talking.
Yeah.
Like, blah, 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 fatigue management. I'm like, oh, you've been doing some reading. I haven't discussed fatigue with you. Yeah.
So, and you saw on Instagram, you did manage to kind of consistently do your powerlifting training throughout your treatment. Is that?
Yes. Yeah. So my treatment was I got diagnosed at the beginning of lockdown. So all the gyms were shut. Yeah. 26th of March, no visitors during surgery. That was pretty awful.
Oh.
But I had my surgery first. I had mastectomy first, and then I wasn't allowed to exercise, for a few weeks. And then, so by the time I started exercising, I'd obviously lost a bit of muscle strength. So I wasn't able to start resuming exercise till I'd had one round of AC chemo, known as the Red Devil, really, really horrible chemo. So clearly from that, I'd lost the muscle mass. Even though I felt like absolute rubbish, I managed to get a little bit stronger every week.
Okay.
And so that was a huge psychological boost, as well as, physically it helped a lot. So, and I was seeing a lymphedema physio and she was measuring me very accurately, and you could see my muscle mass kind of during chemo went up. My fat mass went down a little bit.
Wow.
And then radiation hit and I was in so much pain, I couldn't exercise. And then so the muscle mass kind of, went down a little bit with that. So, and again, that's, research is showing that most people do lose muscle mass during chemo and radiation because of the systematic inflammation, the impacts of the medicine, etc. But in supervised exercise trials, untrained individuals manage to gain muscle mass and bone density.
Wow.
So,
pretty much, those negative side effects.
Yeah, that's right. So,
can you talk a bit more about the radiation therapy? Like, when you're exercising, when you're having radiation, what does it feel like? And tell me about it.
Okay. I'll circle back in a moment. I'll talk about chemo, contraindication first really quickly.
Yeah. I would like to know that.
Chemo. Yeah. Surprisingly, there are not a lot of contraindications.
Okay.
You do need to be aware of the toxic effect of chemo on your cardiopulmonary system.
Okay.
So, standard risk assessment there.
Yep.
So things like, even with anemia, you can exercise, but you'll just become more breathless. So I had to have longer time resting between sets. And I know Steve Collins just posted about cluster sets, which is another recommendation, if you're breathless or fatigued. In terms of, neutropenia, you want to be super clean. Your immune system might be compromised. Even if you've got a low platelet count, you can still exercise. You just don't drop something on your foot.
Yep.
Don't fall over.
Yep.
Common sense stuff. What else? I did write a whole list. So
yeah.
Anyway,
It's a god.
So there's not a lot of, and then of course if you've got a fever, that's an absolute, contraindication. So radiation, radiation, exercise is recommended, but you do need to respect pain over the radiated area.
Oh.
So I managed to keep walking and cycling, but most people don't start to feel the effects of radiation until they've had 10 doses.
Okay.
And then because you have it like 5 days a week.
Yeah.
For however many sessions. I had 25.
Oh.
Some people in there, I couldn't believe it. I was going to radiation every day. There were people in there having like 36, 40 doses of radiation. I was like, mate, yeah. So most people accumulate 10 days and then it accumulates. And what they don't tell you till you're finished, then I got like a nice little brochure telling me it then accumulates for a further 10 days.
Oh, okay.
It's like, so you just respect pain over the radiated area. And I just found anything like, deadlifting, just leaning forward would hurt my chest. Just anything. So I gave it, I did weights for the first 2 weeks, and then I just did walking and exercise bike. And then I resumed strength training about 2 weeks after I'd finished radiation.
Yeah.
Yeah.
Wow.
So.
I've never really spoken to anyone who's had these treatments. Like somehow I've never, and I wonder if people who, I feel like at uni, we were sort of like, if they have cancer, maybe that's a contraindication to certain things. Like, it just wasn't really.
No.
And people tend to panic about exercise as a thing, and when they're unwell, they're like, I have to go to the gym because I'm, they're wrong. And it's interesting that I wonder if people who are diagnosed with cancer, like I can just see how the idea of doing something quite hard, like hard exercise in the gym, they would just feel like that wasn't something they should be doing.
Yeah.
But it's something like I feel like I can see why you've made your Instagram all about it because, we
need to flip it around and say it's more risky not to, it's far, far, far more risky not to exercise. Yeah. And that's like, I think I only managed some of it because I was a physio and I knew. So first thing in the morning when I'd be in lots of pain, but my brain would go, oh, that's just all the inflammation. As soon as you start walking around, you'll feel better. So you go for a walk and, after 5 minutes, you feel better.
Yeah.
The fatigue, again, even though you felt terrible, you'd go and exercise and you'd feel better. I didn't feel great. I just felt less bad. So it's not magic. It's not like you exercise and you're going to be, normal. But it definitely made a huge difference.
Wow.
So
at this stage in your journey, what is it like now? I'm just interested now. Like, what is it like for you post? You're not receiving treatment anymore. Is that correct?
No, I finished treatment. I had 15 months of treatment, and I finished about 8 months ago, something like that.
And you said
correct. Look, there are changes. I was put into a chemical menopause, and I'm on an estrogen blocker. And geez, I miss estrogen. It's such a great hormone for joint health. So I do, if I don't exercise, I do still get significant knee pain.
Okay.
And also, all that pain science we learn. When I'm stressed or fatigued, I can get neuropathic pain over my chest wall from where the radiation was.
Oh.
That's usually a sign to slow down. And the other thing that it's really common in cancer survivors, and I've got my coping mechanism, but when you finish treatment, you're given education, and it's basically, here are the signs and symptoms of a recurrence of cancer, and this is when you should go and get help. So I know for my particular type of cancer, bony metastases can occur, brain tumours and lung tumours. So, of course, if I get a headache, you can't help it. Your brain goes, but because I'm a physio, your brain goes, oh my God, I've got a headache, because I don't usually get headaches. Like, oh my gosh, is it a brain tumour? But because I'm a physio, I can go, hang on. You just went for a big, you're out in the sun, you're a bit dehydrated, you've got no pins and needles, numbness or weakness. Have some water, and if you've still got your headache in a few days, then go to the doctor.
Yeah.
So, you get a back pain, and again, you're like, oh my gosh, is it a back pain or is it a bony metastasis? So that's always there, but at least, I can, I guess assess myself whether it's musculoskeletal in nature and then give myself a deadline of like, if it's still sore by this time, then I've definitely got to go to the doctor.
And I guess like what you just said reminded to me as a physio as well, that like really make sure if someone has got a history of a cancer diagnosis, just to bear that and that those are risks. But of course, it's good to get that kind of direct reminder. And I do feel like sometimes in the patient interview, and you would know this as physio, people leave out stuff they don't think is relevant. And I actually have found people often leave, I've had a history of, say, breast cancer. They often don't even mention it. Like, and I find, actually, and this is a good question, what language is good to you? Like, I am very conscious that I don't want to hurt someone's feelings or bring up a trauma, and so I probably tiptoe around questions too much, just sort of, how's your general health and any kind of major health history, but I don't always go, have you had a history of cancer? Because I feel like that's insensitive. Like, how do you approach that question?
It's no different to saying, do you have a history of diabetes? Do you have cancer? It's just the same.
Okay.
Because it's really relevant, like, as you said, because you've got to be assessing for red flags, like, is this a metastatic recurrence? The main thing is you don't be a cancer muggle. Like, I don't... So, as long as you don't say, I've had some nonsense said to me by health professionals, like, oh, this is a gift, you must really know what's important in life, and, oh, I wish I could have a year off work. As long as you don't say insensitive... Yeah.
Right. I guess you've had...
Yeah. So as long as you just listen and don't tell them how to feel.
Yeah.
But it's such an important part of the history, because it's not only the implications for, it could be a metastatic recurrence, but for example, chemo does a number on your bone density.
Yeah.
Like it messes, so again, you've got to go, okay, so, have they had have they had that assessed?
Yeah.
Do I need to be prescribing exercise to help improve their bone density?
Yeah.
That sort of stuff. Yeah.
Yeah. Yeah. Well, that's like a good little wake-up call to me to just actually specifically ask, because I have had up in the second or third consult and I'm thinking, oh, okay, great. Needed a little bit.
Yeah.
So I'm just going to ask you.
Yeah. The other thing is, like, if somebody's, like, if I've got somebody coming in with a cancer history, my brain immediately goes, bam, bone density, bam, pelvic floor, so prostate cancer, survivors, survivors that have been put into early menopause or on hormone blockers, bam, how's their pelvic floor, bam, do they have could they possibly have lymphedema, have a little bit, closer inspection of limbs, bam, are they fatigued, there's a few different follow-up questions to that. Yeah.
And that's so helpful. That's such a helpful reminder.
Yeah.
So I'm just going to ask you one more thing, but if there's anything you wanted to bring up that I haven't asked you about, you can bring it up after this question. So what do you think the biggest role, like as a physio in the community like me, like what do you think we can do to improve the knowledge around exercise in cancer? Like what can we do?
Okay, so a really good starting point is the Clinical Oncology Society of Australia. They've got a position statement on exercise. But with that, you also need to be aware of malnutrition and sarcopenia, which is really common in exercise as well. So I think, reading those, and they're good starting points. I made a reel this morning with a recommended reading list.
Perfect.
And we can try that in I can try that in the caption here afterwards of a recommended reading list. But if you've got somebody who's just been diagnosed with cancer, encouraging them to exercise. If you can offer exercise, if you've got the type of facility, if you can offer cancer exercise classes, great. If not, find a physio or an exercise physiologist with experience in cancer care, and send them that way. But I think half the population is going to have cancer at some point in their life. So so I think you don't necessarily have to be an expert before you start. You just start with some knowledge and then read like mad.
Yeah.
Read like crazy. So knowing that, I think being aware of, the risk of lymphedema.
Yeah.
And, that's specific. Anyone who's had lymph node surgery can get lymphedema. Most of the research has been done in breast cancer, and there is no upper limit of weight to which a breast cancer survivor can progress to, but you do need to be aware of the signs and symptoms of lymphedema so that you can refer somebody early to a lymphedema therapist. So it would be initial signs would be like the limb feels numb or heavy or tired. There might be indentations in the skin. You can do a quick hitting edema test. You just shove your finger in for 5-10 seconds. If there's a dent in there, whoops, you've got to go to the lymphedema therapist. But in terms of getting lymphedema, you're actually more likely to get lymphedema if you don't use the limb correctly. Normally, sorry. So if you're terrified that you're going to get lymphedema, so you stop using your arm, or avoid using your arm and you avoid weightlifting, you're more likely to get lymphedema. But all the guidelines just say start low, progress slow, any signs or symptoms, send them off to a physio. So again, find a lymphedema physio in your area or a lymphedema therapist, because some have got, OT or nursing background or remedial massage therapists. So you just find a certified lymphedema therapist, refer early. So being aware of that. Encouraging exercise. And there are some very specific things. So, a lot of it's just your bog standard physio. You've got pain. Yeah. You treat normally the way that you would, or you've got a range of motion issues. Your same treatment applies. But a specific one, like in breast cancer, you have to have, in radiation, you like on the radiation table, you like that. But then a lot of people after their mastectomy, they might, again, if they're fear avoidant and not doing their, the physio exercises, they might not have the range of motion. So that's got potential huge consequences if they can't get their radiation. So if there's a delay while they get their physio to get their range of motion back going. So, yeah.
And do you use soft tissue techniques in that or not? Is it just active?
Yeah.
You do.
Both active and passive, but it's like in hospital in Australia you see a physio before you leave hospital, and they give you exercises to do 4 times a day.
Yeah.
And it doesn't feel, it's not pleasant.
Yeah.
So if you're not doing them, you can get quite stiff. So, but it's a fine line. You don't want to be over aggressive with it because you've got to give the lymphatic system a chance to recover.
Yeah.
So you don't push into pain, and you've got to be a bit careful in that first, week or so. And while you've got the drains in, you can't be exercising above your head. But you do need to, work on that range of motion. So that's, and there's cording as well.
Yeah, the cording, yeah.
Yeah. Again, it's, you can either do a course on that or find a therapist that specialises in that and get them to treat that.
Yeah, that's probably what I do. Because I feel like the more I know about stuff, the more I'm like, oh, wow, there's way more to know than I know, and there's someone else who's treating. And so it's best to just go to that person who's an expert. So something I'm chat as well is find people near Northside Brisbane on all of these things.
Yeah. But the problem we've got is there's not enough people with these skills to go around. Yeah. And this is why I say I don't think you need to be an expert to start. You just do some reading and then do some basic reading, get started and learn as you go. Yeah. And like my powerlifting coach trained me during so she obviously did some reading as well, and so she trained me. So there's not enough expertise to go around. And I'll just tell you a story because stories best highlighted. I went to it was a cancer, exercise research evening at the uni, and I ran into another breast cancer survivor, and she said, I've always been a runner, but my oncologist has told me I need to do some strengthening work. And I've been to like 4 different gyms, and none of them want to have a bar of me because they're scared. So I'm not doing any strength work.
Yeah.
And I'm like, well,
Yeah.
so yeah. So I think again, the message, if I bang it home, 50% of people are going to have cancer at some point in their life.
Yeah.
So rather than going, oh, too hard, do upskill yourself. But again, you know your boundaries. You know, okay, they're showing signs and symptoms of lymphedema. I've got to send them to the lymphedema therapist. They've got, you know, terrible range of motion, and I'm not all over this courting business. I'll send them to a therapist. But provide those, you know, if you've got a facility where you can provide exercise classes, go for it, because it's just such an important part of treatment, not just physically, but psychologically as well. Yeah.
Well, I actually feel really motivated to kind of do something like that.
Yes.
Thank you for that. I feel like this chat has just been...
You can do it, Frances.
...for me, and I've loved it. So in the next time I'm going to meet, well, next time we chat, it's going to be in person. And I'll just mention now we're going to do WeHab is my little meet and greet for people who are working in health and rehab, and I'm going to get you and Steve Collins to talk at the event. So you'll be talking about these topics. And so I feel like that is a good way to get this message out, and hopefully ETs and science and even personal trainers will join.
Yes.
And then they can kind of hear and maybe feel, especially if there's an ESSA guidelines about exercising cancer or something like that, feel safe to do this and get people exercising.
Absolutely, because as I said, there's never going to be enough, health professionals to go around. And a 2019 paper from the American College of Sports Medicine have actually broken it down into a table of, this is your risk management if you're a fitness professional.
Yep.
This is how you do your risk management. And these higher risk people should go to an exercise physiologist or a physio or a physical therapist with, expertise in cancer care. So, rather than saying, it can only ever be done, you don't want to gatekeep, because I keep saying only 8% of cancer survivors meet the guidelines. So you can't just, add another barrier, say, no, it can only be supervised. So fitness professionals with extra training, go for it, but recognising your scope, referring on to somebody else, if they're high risk. And I'll stick that paper in the caption description as well.
Please. Okay. Thank you so much for this great chat. I'm going to promote it so much for people to listen to, because I just feel like it's been so helpful. And I'm looking forward to meeting in person and all your other posts that I can enjoy as well.
Okay, excellent. Lovely to meet you, Frances, and thanks for asking me. Okay, bye-bye.